Today I want to talk with you about breast augmentation surgery. Breast augmentation, as the name suggests, is for patients who want to make their breasts larger. This can be from loss of breast tissue following pregnancy. This can be for patients who simply haven't developed breasts to the size that they want, or sometimes for patients who have breasts that have developed into two different sizes. So we'll want to augment one side to make it match the other normal side. There are a lot of decisions to make when I'm consulting with a patient who wants to have a breast augmentation. Number one is, what type of implant shall we put in? Should it be a saline implant, which is a bag that's filled with saline or saltwater solution? Should it be a silicone implant, which is a bag that's filled with a thick silicone gel? Or should it be one of the newer gummy bear type implants, which is filled with an even thicker silicone gel? These are decisions I'll talk with you about, and we can make the decision at the consultation. The second decision we need to make is, where should the incision be? There really are four choices in where to do this. The most popular incision is made right underneath the breast, in the crease where the breast and the chest wall meet, called the inframammary fold. A second incision we can make is around the areola. A third incision we could make is up in the armpit area. And a fourth incision we could make is actually down by the belly button and tunnel from the belly button up into the breast. That way the incision is kept well away from the breast. Again, these are decisions we'll talk about in the initial consultation. The next decision we need to make is, where do we put the implant? Well, it seems obvious you put it in the breast, but we can put it directly behind the breast so it's sitting on top of the muscles of the chest wall, or we can put it behind the muscles of the chest wall, or we can put it in a position called the dual plane position, where it's partially underneath the muscles and partially underneath the breast itself. Which decision to make, again, will depend upon individual differences. There are advantages and disadvantages of each decision, and we can talk about that. Another decision is how large an implant to put in. Well, obviously part of that decision making is the patient's desire. Part of it too is, how wide is the chest wall? At the initial consultation, what I'm going to do is measure how wide the chest wall is. Breast implants don't come in A, B, C cup sizes the same as bras do. They come in cc's of volume. And so when I'm looking at the proper breast implant to insert, what I'm going to be looking at is, number one, the total size, and number two, how wide is the implant. I don't want to put a breast implant in that's wider than the chest wall, because the implant is just going to go around on the side. So we need to choose an implant that matches your chest wall. The next decision is, what shape should the implant be? Should it be round? Should it be teardropped? And that decision is made by how long the chest wall is. The next decision is, when we put the implant in, should it be a textured implant or should it be a smooth-walled implant? Again, there are differences in the two types of implants. There are advantages and disadvantages to each, and these are things we talk about at the initial consultation. Patients generally really enjoy having a breast augmentation. It allows them to wear clothing that flatters them. It allows them to feel more feminine, and this is a great operation. Patients are very happy after the breast augmentation surgery.